Stewardship is the job of taking care of something. Children's Wisconsin has a diverse and well-planned financial strategy. For Children's to be able to invest in kids and families now and into the future, all of us, leaders, employees, and providers, have a role as financial stewards. Chapter 1. Why is that important? Our vision that the children of Wisconsin will be the healthiest in the nation directs us to do all we can to provide the care and support kids need. The services we offer and the way we get paid continues to change. The healthcare landscape is very competitive. This means we need to use innovation to enhance services and reduce expenses. We get paid for the services we provide in a number of ways. There are also some programs that we don't get paid for or that we get paid less than our cost. This includes services across our mission of caregiving, advocacy, research, and education. To do our work, we need to invest in our people, technology, and infrastructure, including our equipment and facilities. Because the healthcare landscape is constantly changing, we must continually adjust these investments to ensure we can best support kids and families across the continuum of care. Families and employers are sensitive to the cost of healthcare, so our financial strategy can't just be charging more for the care and services we provide. We can all contribute to children's financial health and sustainability. This requires a disciplined focus, using the resources we have as efficiently as possible and looking for new ways to bring dollars into our organization. Chapter 2. Definitions. To make good financial decisions, we all need a basic understanding of how children's finances work. Let's start with a few definitions. Revenue. Revenue is the income we earn and other funds that come into our organization, such as gifts and grants. Expense. Expense is the term for the costs we incur to provide services. When you subtract our expenses from our revenue, the amount left over is our operating margin. Unlike a for-profit company, we don't use our operating margin to pay shareholders. Instead, we reinvest our margin in programs and services kids need, our technology, and our infrastructure, such as our buildings. We also use our margin to support investments that ensure Children's will remain financially solid for years to come. Chapter 3. Our work. Now let's talk about revenue and expenses and the main buckets of our work: clinical care, our work in the community, our health plan, and philanthropy. Clinical care. Our hospitals, surgery center, specialty, primary, and urgent care clinics, as well as our other clinical services, generate revenue when families or their insurance companies pay us for services. The largest expense throughout our organization, including our clinical areas, is our employees. Salaries and benefits make up about 40% of our expenses. Kids deserve the best, so we need to recruit and retain the best workforce. Other clinical expenses include medical and pharmaceutical supplies, medications, and purchased services such as temporary help and blood products. Community work. We provide many services outside the walls of our hospitals and clinics, including education, supporting kids' mental and physical health in schools, and child well-being and advocacy activities. Revenue to support this work comes in the form of grants and contracts. In some cases, we are paid by families and insurance companies for these services. Labor is again our primary expense related to this work. Health plan. Children's operates a not-for-profit health plan called Course Community Health Plans. It offers two types of products that generate revenue: a Medicaid plan and a plan for individuals buying their own insurance. For our Medicaid plan, the state of Wisconsin determines how much it pays for each individual enrolled in the plan. For the plan we sell to individuals, premiums are paid directly by these members or by the federal government via premium subsidies for individuals who qualify based on their income. Our health plan's primary expenses come in the form of payments to healthcare providers for services provided to plan members. Our health plan margin is used for programs that improve the health of members and that support our other strategic priorities. Our fundraising efforts bring in revenue through gifts and grants. The money generated through our foundation has an impact on our overall financial health. It supports programs and services we offer at Children's to advance the physical, mental, dental, and social health and well-being of kids, especially those things other payers and funders don't invest in. As we mentioned in the last chapter, our margin is reinvested across the system. This supports everything from our people to our quality, safety, and experience work to the advancement of our other strategic priorities. Our margin is essential to funding our vision of the healthiest kids. Chapter 4. Extra Credit. Let's dig a little deeper into one of the most important ways the finances related to our clinical services are unique. Healthcare has a very complex payment structure, and there are elements of it that we can't control. This can be confusing for families. They may pay insurance premiums, co-pays, and other out-of-pocket costs. So what individual families pay for our services varies, and the amount we are reimbursed by insurance companies also varies widely. Some pay us 100% of what we charge, and others, such as government payers like Medicaid, pay as little as 10% or nothing at all. We are committed to treating all kids regardless of what we get paid. It's critical for us to operate efficiently so we can continue to provide all kids with the best and safest care and continue to reinvest into our organization so we will be here for Wisconsin families for years to come. Chapter 5. Your Role. There are many ways you can care for and nurture our financial stewardship work. You can plant new ideas that reduce variation and align processes. You can trim expenses and waste by finding improvements and efficiencies in the work you do every day. And you can look for new ways to grow sustainable revenue. Embracing children's values of innovation and collaboration will help. Have ideas? Share them with your leader. Search Bright Ideas on Children's Connect to learn more about how you can cultivate this important work. By being good financial stewards, we all help ensure Children's will be here for kids and families well into the future.